My name is Jared Gallagher. I'm an assistant professor of surgery here in the Division of Trauma and Critical Care and General Surgery. I remember, loving like the Magic School Bus books where they travel through the human body, and I just always had a fascination with that, but really enjoy working with people. I'm very extroverted and like the opportunity to work with patients and their families, and I just think it's a real privilege to be able to be a part of this difficult time in people's lives and help escort them through that while still getting to use my skills as a scientist or a physician. And I just think medicine brings a perfect marriage to those things in a way that a lot of other fields don't. I really enjoyed, when I first got exposed to surgery in medical school, how the sort of almost like craftsman aspect to learning how to do these skills and procedures that I had never been taught before, never even really seen. And there's just a real satisfaction in working with your hands and getting the opportunity to do these very concrete things to help people and fix a problem. And we often joke that we're just plumbers or whatever, but in reality we're given this incredible opportunity to see and experience human anatomy in a very intimate way, and that also really helps people, and I just think that's a really powerful thing. Our division and myself offer an array of different services. So in addition to taking care of people in critical illness or after a traumatic injury, we also take care of a lot of common problems that people can come to see us in clinic. So I have a regular clinic. We also have a same-day clinic as part of our division where people can call in and come in even the same day. And we treat a lot of common problems such as hernias, gallbladder problems. Those are probably two of the most common ones. Diverticular disease, so people who need a colon resection for diverticulitis. So we do a lot of those types of procedures regularly. And so in addition to doing my trauma practice and rounding in the surgical ICU, I also see patients in clinic, and then we can schedule those people for elective operations to take care of those types of problems. I really try to focus on offering patients is authenticity and honesty about what the problem they're facing is and what the potential solutions are. And so I work really hard to give patients an opportunity to really express what they're concerned about, what their needs are, what their fears are about addressing a particular problem. And then I try to be very honest with them about what we're facing ahead of us. And sometimes it's a very simple thing, like I need to have this bump removed from my arm. And sometimes it's a life-threatening problem. And so I want to be as honest with them in every situation, no matter how serious or not it is, so that we can have a authentic conversation about what it is that we need to do to help them. And I think patients really respond to me being upfront with them, and while also trying to have empathy and care about the situation they're going through. And I work really hard to do that either in the clinic or whether it's in the emergency room or in the ICU. I grew up in rural Kentucky. I grew up the son of a minister, and so faith was always a very important part of my upbringing, and is an important part of my life today. I think it's an important aspect of why I care about medicine, and I see a lot of what I do as a service to others and caring about the welfare of the people around me. I love living in the South. It's where I've spent my entire life, and where all my family is from. North Carolina became home almost 15 years ago, and I've been here ever since. I love the people of North Carolina. I love the beauty of this state, and I think it's a unique place to live and practice. My great-great-grandfather he's the only other physician in my family, but he was a country horseback doctor riding through Middle Tennessee almost 100 years ago now. And while I obviously don't ride horseback through North Carolina, I really like taking care of the people that live around here and connecting with a lot of the rural people of North Carolina in particular, as it reminds me a lot of my childhood and the people I was friends with and grew up with and my family that lives in Tennessee today.